What do we want?
Safe staffing.
When do we want it?
Now.
What do we want?
Fair pay.
When do we want it?
Now.
This picketing in central London is part of a 5-day strike by resident doctors in England. Resident doctors make up about half the medical workforce in the United Kingdom, and nearly 50,000 of them are on strike. Pay is at the heart of the dispute. The British Medical Association, which is a trade union comprising medics, is demanding higher pay, unhappy with the 5.4% raise given to them. After coming to power last year, the Labour Party was quick to reach a settlement with doctors for a 22% pay hike. But this year, with public finances strained, it has refused to go beyond a 5.4% increase. The BMA points to a gaping irony. A resident doctor with years of experience gets paid less than £19 an hour, while a qualified doctor's non-medically qualified assistant is making over £24 an hour.
Well, what I say to the public is that no doctor wants to be on strike. I've dedicated my life to looking after patients. I work as a child psychiatrist, a resident doctor in child psychiatry, and I've seen so many seriously unwell kids who are suicidal, kids who are self-harming, kids who are locked in their rooms, and they haven't seen a specialist for over a year, and that's simply because we don't have the doctors. Doctors are tired, doctors are burnt out, and doctors are leaving. I have had my own colleagues, my own talented colleagues leave for other countries. Australia, they're going to Melbourne, Brisbane, Sydney, Perth, Adelaide, and they're going because they're getting paid more and they have better working conditions. If we want a first class, a first world healthcare system, then we have to pay doctors. We have to agree to pay doctors simply just over £22 an hour. Even if we paid doctors £22 an hour, that'd still be a bargain for the country.
Adding to the discontent is the fact that a Labour government is refusing to accede to demands by a trade union. BMA says salaries of resident doctors will be 20% lower in real terms than what it was in 2008. This, even after a 5.4% increase takes effect in August this year. It wants to pay for the group to be brought back in line with the level it was 17 years ago, when they say their pay began eroding.
Trainee psychiatrist, I work on wards where people are being discharged at alarming rates, where my patients are ending up homeless on the streets, and meanwhile Wes Streeting on his 90k salary wags his finger and tells us we shouldn't ask for the pay that we're owed.
What we're asking for is to restore our pay back to 2008 levels. We're not asking for a single penny more. And what that would look like is a doctor that's currently paid around £18 an hour. We're asking for that doctor to be paid just over £22 an hour. £22 an hour to deliver life-saving treatment, £22 an hour to restart people's hearts, £22 an hour to look after hundreds of patients overnight. Mr. Streeting can come today and say a doctor should be paid £22 an hour, doesn't even need to reach there all in one go, and we can call off the strike for now and for future years.
The government calls the strike reckless, saying it is bound to create disruptions in delivering healthcare. And it expects doctors to be more sympathetic.
We are doing everything we can to minimise the risk to patients and to minimise the disruption. But I want to be honest with people. What we can't do is eliminate disruption or risk to patients. We know that there have been operations, appointments and procedures already cancelled, and we know that there will be real challenges over the next 5 days. And that is why the Prime Minister and I are so angry on behalf of patients and other NHS staff who are working hard to keep the show on the road, that the BMA have taken what is reckless and unnecessary action, forgetting that they've had a 28.9% pay increase from this government, and this government was also willing to go further on improving their working conditions.